Hi, it's Dr. Centeno, and I'd like to spend some time today talking to you about Regenexx. And this is really going over everything we do from a 30,000 foot view standpoint. And this is a zooming type presentation, so this is everything we're going to talk about. Who we are, why we're here, how we're different, how do we think, who are our patients, what do we do. We'll talk about stem cells, the stem cell supplement a little bit, talk about bone marrow and adipose stem cells or bone marrow and fat stem cells, same-day stem cell procedures, some specific types of procedures, the cultured stem cell procedure, blood injections that we do involving platelets, go in and talk about some of the spine work we do, then finish up with safety and then some final comments. So let's get started on this. Again, this is an overview type presentation. So who are we? Well, if you look at a map of the United States, we're out here in Colorado, but we've trained other physicians around the country. And this is this map, by the time you see this, may or may not be updated. But generally, we've trained people on the West Coast and in the Midwest and in Chicago, as well as in the Northeast, Florida and the South. And the reason why we've trained those doctors is because we believe that what we're doing is really quite different. And that whole Regenexx network and a Regenexx network provider, really a special group of doctors. For every 10 doctors that ask to be on the network, we actually only take about 1 or 2. So it's a very selective group. So let's focus in a little bit here in Colorado. We live in a beautiful place. We are a regenerative medicine practice in Colorado, and we've been doing regenerative orthopedic medicine involving stem cells really longer than anyone else in the U.S. We performed our first stem cell reimplants for knee and spine in 2005. So we've been doing this approximately a decade. And so we've been at this a very, very long time. I've written several book chapters and published quite a bit in the peer-reviewed literature on stem cells. And you might have seen us any number of different media outlets where we've been covered. We've been on the Doctors 2 separate times, most recently, and lots of other publications. More recently, we were in Outside Magazine, which is not listed there. Our practice is sited in a really pretty spot just outside of Boulder, Colorado. I actually live in Boulder. It's a very pretty part of the country. And again, we've performed more advanced orthopedic stem cell reimplants than any other clinic in the world. And we've been at this the longest. So if you're looking for experience in a stem cell provider to treat peripheral joints, back, neck, spine, we've been at this longer than anybody else. There's no one even close. So that's who we are. And again, we've trained physicians in what we do around the country. That's the Regenexx network. And we'll talk a little bit about that later, but this gives you some sense of who we've affiliated with. So why are we here? Well, I think one of the more interesting ways to try to see why we're here and why there's this need to look for other ways to treat patients outside of surgery is because there's been a lot of research this last number of years in how well more invasive orthopedic surgery actually works. And I don't want to spend too much time on this, but we'll start by playing what I call Orthopedic Research Jeopardy. And this is just a way to try to get you to understand how little scientific information we have that traditional orthopedic surgery is effective. And over here, you'll see the scientific references for this board. But I'm just going to go through a few of these to give you some sense of what's out there and what we know and don't know. For instance, knee for 200. This knee surgery is no better than placebo. And the answer to that would be, what is arthroscopic knee surgery for arthritis? Despite the fact that arthroscopic knee surgery for arthritis is extremely common, we know very, very little about it. And in fact, when it's tested against a fake surgery, it's no better than a fake surgery. For hip for 200, this minimally invasive hip surgery is associated with metal toxicity in the blood. That would be what is hip resurfacing surgery, or a metal on metal hip replacement. So again, very common over the last 10 years, these minimally invasive hip replacements. The biggest problem with them is that there's a lot of wear particles, and more is coming out every day about metal toxicity in the blood. How about shoulder for 200? 8% of these surgeries have serious complications, and only 2 in 3 heal by 1 year. That is what is rotator cuff surgery. So again, another mainstay of American orthopedics. Many surgeries, about 40,000 a year, occur, but we really don't know that they're all that effective, and we certainly know, however, that they have some complications. How about steroid injections for 200? This injection kills stem cells and makes tennis elbow worse. What is a steroid injection for tennis elbow? Again, I think you get the picture that basically we're here really because we need a new way to treat patients outside of surgery. And if you just look at the board real quick here, you'll get an idea of how much we really don't know, and how much traditional medicine is really failing our ability to take care of our musculoskeletal system and fix problems. So that's a little bit about why we're here. Let's now go into how we're different. So if we look at how we're different, I always like to think of it as an iceberg. You know, these days, well, actually going back a little bit to 2005, there really wasn't anyone else doing this kind of work in the United States. By about 2007 or 2008, there were a few people that popped up doing this kind of work, but not many. By 2010, we saw a few more. By really 2012, we started to see a small explosion, and many more in 2013. Physicians doing this kind of work using stem cells. And these days, it seems like you can go on the internet and see any number of advertisements for stem cells. And I put an exclamation point at the end because it's almost like it feels like that. It feels like there's a lot of advertisement for stem cells, but patients don't really understand that there's an awful lot, just like an iceberg, that needs to be under the surface to really ensure that you're A, getting stem cells, and B, that the actual processes being used are likely to help you. So let's look at how we define, how we define what's underneath that iceberg. And that would be having a patient registry, a full research lab facility, having obviously extensive experience, a lab to process cells, publishing in this area, and imaging guidance to place cells. So let's start with a patient registry. What do I mean by that? Well, anytime a physician does something new, there has to be a data collection process. And we actually track every patient we treat in a clinical research organization style registry. We currently employ 3 full-time people just to maintain the registry. We have a full-time biostatistician to look at all of that data. And we're tracking thousands of patients in that registry. Now, I have to be honest with you, there are very few people doing work in stem cells that have that level of commitment. to patients. But we do it, and it's a very expensive process, but we believe it's absolutely necessary when doing a new procedure. And I think you'll be hard-pressed to find any other clinic outside of our network physicians that have that kind of transparency, and also that put that kind of data on their website. And we'll talk about that in a little bit. The other is a full research lab facility. So again, I think what you'll find here is something very, very different. Most physicians offering stem cells for orthopedic problems have a little bedside centrifuge. Their knowledge of stem cells really stops at, I push this button after I put the stuff in here. And on the other side, you've got physicians doing adipose stem cells who, again, are maybe processing some adipose stem cells in a hood, but have very limited knowledge and no ability to go deeper and to answer some of the basic questions that need to be answered if they're going to do really good work. Now, that's very, very different for us. We have a full research facility to back up Regenexx that includes things that you would find in a university stem cell lab like flow cytometry, fluorescent microscopy, ELISA, real-time PCR to look at the genes that cells are expressing, etc. So we have the ability to dig deeper. Also, this is another example of actually when we were researching our stem cell supplement. Here, looking at the ability of stem cells to make cartilage components and whether or not different supplements were helping or hurting the ability of stem cells to make cartilage components. And this is with fluorescent microscopy. This stuff in here that's bright is actually the cartilage components. The darker areas are the stem cells. Again, we get asked that question all the time. What supplements should I take? And the answer was, there really isn't enough information. We're going to have to do that research. So again, a state-of-the-art lab facility, really important. Also really important, a lab to process cells. So again, not just a bedside centrifuge, but a real lab. What does our lab look like here in Colorado? Let me see if I can pull this up and get this. Well, that's not going to work. But a lab to process cells and not just a bedside centrifuge. Research publications. We've been publishing on this and continue to publish on our work. We began all this with a 2-year IRB-approved research-only effort from 2005 to 2007. We publish a couple papers a year. We have a full-time research staff as part of that practice. These are just a small number of the publications we have on stem cells. I've presented twice at the Vatican and Rome on this topic, as well as a lot of different other universities. These are some examples of some of our research studies that have been published, but we have many more. Imaging guidance to place cells. So you wouldn't want to spend all this money on an expensive stem cell procedure only to not be sure that the stem cells got where they were supposed to go. So we're an interventional orthopedics practice, and the guys in our network are experienced in interventional orthopedics. That's the ability to precisely place the cells where they need to go. So again, there's an awful lot that goes underneath the surface if you're looking at a stem cell clinic. And 99% of the time, all you get is this. You don't get any of this stuff below the surface because money isn't being spent there. It's being spent on the advertising. So how do we think? Well, that's a pretty important question for any physician you're going to see. And again, we try to do this differently as well. We don't just look at the actual joint. We look at the stability of that joint. We look at the nerves and muscles that might or might not be causing issues. We look at the overall body symmetry. So we take a whole person approach to how we look at patients. We don't just throw up an image and spend 5 minutes with a patient and say, yeah, your knee looks bad on the picture, so we need to inject some magic pixie dust stem cells in your knee. We actually focus on these other issues as well, because our goal is to help you long term, not just to sprinkle pixie dust on your problem. And if you really want to get a good sense of how we think, go to the website and download the Orthopedics 2.0 book. It's now just starting its 3rd edition. And it's a really great way for you to get a sense of how we conceptualize problems, which we think is pretty critical. So who are our patients? Well, we treat professional athletes, but we obviously also treat an awful lot of weekend warriors, young athletes, and an awful lot of patients who just want to stay active as they get older. And in fact, staying active as you get older is a big thrust of our practice, because we ourselves are aging athletes, and we're trying to stay active as we get older as well. So what do we do? How would we summarize that? Well, we believe that we're the world's most advanced practitioners of regenerative orthopedics, and our goal is to try to help patients avoid surgery. We have lots of different parts of our practice to ensure that that continues to happen. So we're going to leave now the theoretical a little bit and go on to the practical. We'll be talking in general about stem cells and then about specific procedures. So let's first talk a little bit in general about stem cells. Stem cell is a master cell that can repair tissue by changing into the needed cell type. It can also help to orchestrate a repair response. The types of stem cells we're talking about today are adult mesenchymal stem cells and hematopoietic stem cells. Where do we get your stem cells? And again, we just talk about stem cells taken from your body, used in your body, or what's called autologous. And we can get those stem cells from any one of a number of locations, primarily bone marrow and fat. And we can also get platelets from the peripheral blood. For orthopedic purposes right now, there's an awful lot more research showing that bone marrow is more effective than fat. Even though you see a lot of practitioners out there using fat, and we use fat as well, bone marrow actually has far more research showing it's effective in orthopedics. And this is just to give you some example on the published data. This is the amount of published data in fat stem cells in orthopedics versus bone marrow. So quite a big difference there. Now, let's say you're going to come for a procedure here. I'm going to zoom in on this area. We really do this 2 different ways. One is we can take a stem cell sample, and we can isolate those cells by the lab and inject them the same day here in the US or in Colorado. Or we also have the ability to culture the cells to get many more, and that's currently through a lab in Grand Cayman, which I'll talk about in more detail later in this talk. And one of the things that we spent a lot of time working on to try to help your stem cells do better is a stem cell focused supplement, or what we call the Advanced Stem Cell Support Formula. And you should really take some time and go on the website and watch the little video that describes how we developed this, because again, we just didn't pick some supplements out of the air that we thought might help, or that there might be one little research study on here or there. We actually tested these supplement agreements or ingredients over a year with human stem cells to try to get those ingredients that would actually do what we wanted with stem cells. So again, we had to redo our own research that was more focused in the area we wanted it, rather than do what most supplement manufacturers do, which is basically take just a bunch of unrelated research, stitch it together, and throw some things in a bottle. So again, something to consider if you're undergoing an orthopedic stem cell procedure. Now we'll go talk a little bit more specifically about bone marrow and adipose stem cells. Let's start with bone marrow. So how do we get your bone marrow? We use a marrow draw and not a biopsy. And that's a pretty big difference. Most people think of a biopsy when they're thinking about a bone marrow procedure and not a bone marrow aspiration, which is what we do. A bone marrow aspiration occurs right at the back of the hip here. So these are the actual hip joints. This is your tailbone, and this is called the PSIS area, or the dimples of Venus area. And what's the most common thing we hear when the procedure is complete? Basically that wasn't that bad. In fact, way back in 2009, we looked at this in more detail, and about 8 to 9 in 10 of patients said that the bone marrow aspiration procedure was really comfortable and not a big deal. So again, people have in their heads that this bone marrow procedure is going to be painful or a very big deal, and it's not at all. In fact, a bone marrow aspiration procedure is much safer than a liposuction procedure. A liposuction procedure is actually far riskier than a bone marrow procedure or a bone marrow aspiration. So we can also take cells via adipose cells or fat cells, and we'll go into that in a second. But going further on bone marrow, we have a same day and a cultured procedure, same day and cultured. So let's start first on the same day procedure that we can do here in Colorado. The same day procedure is basically done in patients that have less severe joint arthritis, partial to complete ligament and tendon tears, more complex meniscus tears. And actually, our more recent data has shown that the same day procedure also seems to work pretty well in knees, not so much in hips, but in knees when they're more severe. So if we look at the same day procedure, the goal of this procedure was to beat the number of stem cells that could be obtained by bedside machines, because that's the most common way stem cells are processed. Again, a doctor gets a sample, he puts it in a magic machine, presses the magic button, and out spits what he's going to inject. Our goal was to beat that, and not just beat it, but really, really beat it. So we developed an isolation procedure that actually takes 2 fractions out of the bone marrow when everyone else just goes after 1. Turns out there is a second fraction in bone marrow that has a lot of stem cells that everyone else discards. And by doing that, we can get to 15 to 20 times more stem cells per cc than most of these simple bedside centrifuge machines. We can also add things into that stem cell mix to try to get the stem cells to grow better. So this is an example of various different types of platelet mixes that we were able to add to get stem cells to grow better in culture. And if you want just a general example of the kind of patient this works well in, this is a gentleman who had some problems underneath his kneecap with his cartilage. He had some laxity in the ligaments and the ACL, and we were able to treat his arthritis through the Regenexx SD procedure. And if you go on the website, you'll see this area, and this is under the outcome information. And again, we're one of the only practices in the world really that puts out this type of detailed information by body part. These are all of our knee patients that we've treated in the last year with this procedure. These are all the knee patients we've treated with the adipose procedure. This is all the hip patients, shoulder patients, hand, wrist patients, foot and ankle patients. There's also an infographic for complications. So we pride ourselves in putting out this kind of very specific data on an annual basis, and you're not going to see that anyplace else. The most you'll see is maybe a satisfaction survey, which is the kind of thing you would see at a car dealership. We actually have a treatment registry using validated questionnaires, and we let it all hang out. We'll show you all the data, and any data we don't show you will be explained in the infographic for whatever reason. So very, very important that we have this kind of information and that we can share that kind of information about hundreds or thousands of patients that we've treated with our patients. We also, in addition to the same-day procedure, have a cultured procedure. We tend to use the cultured procedure in more severe arthritis, but not all joints really necessarily need it. Some knee joints do need it, but more hip joints with severe arthritis tend to need this. We've learned through our registry data that for whatever reason, thumb arthritis patients tend to do better with a cultured procedure than a same-day procedure. The cultured procedure is only available outside the U.S. It's not performed by us, but by licensees that license this procedure. And it's not approved by the U.S. FDA for use in the United States because it's considered a drug here in the U.S. So an important distinction to make. The Regenexx procedure is the culture procedure. This is where we grow the stem cells to much larger numbers over 10 to 14 days. It produces a pure population of MSCs, or mesenchymal stem cells, and we have the ability to save the cultured cells for future use. This is an example of the facility down in Grand Cayman. We've seen lots of professional athletes down there, movie stars, etc. The Regenexx Cayman lab is very similar to the research-only lab that we have here in Colorado, although this one is focused on treating patients. You do have to go down to the Cayman Islands to get your stem cells taken and then put back in. This is an example of the kinds of things that we have seen with this procedure. This is a woman who had a big hole in her cartilage. You can see here on this special type of MRI, the bone is dark, the cartilage is light. The dark area here at the yellow arrow going across the top represents a hole in the cartilage. Down here you can see smaller amounts of dark areas at the yellow arrow, indicating that that cartilage lesion is smaller. This is a patient with a severely what's called mucoid and degenerated meniscus. You can see here this meniscus should be uniformly dark, but it's kind of light, and that's this triangular shaped structure here. And you can see here an improvement in the meniscus signaled by quite a bit. And in fact, the radiologist agrees with the improved appearance of the meniscus. These are the sorts of outcomes that we have seen with the Regenexx procedure. For knees, this has actually already been published. And this is knee and hip patients, and this is average percentage improvement. So approximately 60% improvement. Now that means that you might have had some patients way down here and some patients way up here, but that gives you some example at about 1 year out. And in general, the cultured procedure tends to work better for more severe hip arthritis patients than the same day procedure. And the knees aren't quite as different. This gives you some idea of the percentage improvement over time. And this information is actually on the website of the provider that handles this in the Cayman Islands. This is an example of an NFL player we've treated who did very, very well. We got him another year out of his contract as a result of that injection. And this just gives you some idea of the amount of data that's been published on the Regenexx cultured procedure versus the Carticel procedure, which is a cartilage procedure here in the United States. So That's the same day procedure and the cultured procedure. So you can see those two right here. The adipose procedure, or using adding in adipose stem cells. Basically, AD stands for adipose derived. That means that we can also add in some stem cells from fat, and you kind of get the best of both worlds. Some of the advantages of fat stem cells, i.e. there are a lot of them, and also the advantages of bone marrow stem cells being more specific to orthopedic use. And then we also have procedures, and these are just two examples of those, that are much more focused in a specific area of the body. So in this case, the Regenexx ACL procedure and the Regenexx rotator cuff procedure. So on the ACL procedure, one of the problems with getting your ACL surgically replaced is that the normal ACL goes in at this 45-degree angle or so. The artificial ACL position goes in at a much steeper angle. And so you tend to see ACL graft shear and other problems over time. With the Regenexx ACL procedure, we're actually able to go in and precisely place stem cells into the tear. And we've seen good evidence on post-op MRIs of healing of ACL tears when we precisely place stem cells into the tear under fluoroscopic or ultrasound guidance. This is the Regenexx rotator cuff procedure. It's targeted on the rotator cuff. And in our registry study, about 7 in 10 patients reported 70% or more relief. That should be a 70%. And this gives you some idea of some of the kind of things that we can see with this procedure. This is a large gap in the rotator cuff tendon here, or a tear. And then afterwards, that tear being much, much better on a post-op MRI. This white stuff here is a bunch of swelling and fluid. So it gives you some idea of that type of procedure. We also do quite a few blood-based procedures, and those are platelets. Platelets are different than stem cells. The focus here is to take some of the platelets from your blood and super concentrate those. That isolates the platelets, and it's been designed by us to maximize stem cell growth. We don't use mass manufactured machines like 99% of the doctors do to make platelets. We do that in our advanced lab as a customized procedure for each patient. And there are reasons why we do that. Here's an example of the difference that you can see. The type of platelet-rich plasma that we make does not contain red and white blood cells. This is your average PRP, which is red, and this is our version of PRP, which is amber. And that's because these red and white blood cells can cause problems. This is an experiment we did with our type of PRP, looking at the amount of stem cell growth versus a bloody PRP. And the red blood cells and white blood cells really cause problems with maximizing stem cell growth. You're many times using platelets to maximize the local stem cell growth to try to get something to repair. So you really don't want to have issues like this causing problems with stem cell growth. The other thing with our SCP, or our concentrated platelets, is that we can go to very high concentrations. So while most bedside machines can go to 3 or 5 times concentration over the baseline number of platelets, we can get all the way up to 10 or 20 or 30 or 40 times. And that's important in maximizing stem cell growth. These are patients in their 30s, 40s, and 50s. And this is the increase over baseline in the ability to get their stem cells to grow when we super concentrate platelets. Again, most machines can only concentrate to 5 to 11x. We can go all the way up to about 40x if we need to. And the kinds of things that we would use platelets to treat, a shoulder rotator cuff tear, where there's a partial tear. Someone who has a partial tear in their ACL.
I am now.
Let me show you this particular patient here. So right around the time that patient would have been just getting off of crutches and starting rehab, she's got a 40+ inch vertical leap because we didn't rip out her ACL. We injected platelets, her own platelets into it to try to heal the tear. And she was able to keep her own ACL and recover much, much more quickly as a result of that. We also treat smaller meniscus tears with the patient's own platelets. Now going into spine a little bit, we have two procedures here, the Regenexx PL disc procedure and the DDD procedure. I'll focus on this PL disc. The concept here really is an epidural steroid injection replacement. Recently, there's been a lot of problems noted with epidural steroids or using steroids through injection to treat swollen nerve roots. There's been many studies showing that, especially in middle-aged and elderly women, the steroids are really hurting their bone mass and increasing their fracture risk. Instead of that, we take the patient's own blood platelets, we concentrate those, and re-inject those into the spine. And this is an example of some of the data through our registry that we've collected. Basically on functional improvement, showing much better improvement on functional questionnaires over 3 and 6 months when compared to traditional epidural steroid injections. So let's go into safety real quick here, and then we'll end this up. Again, we're very, very, very focused on registry participation. We've published lots of different safety studies. We've followed through the Regenexx procedure, 339 patients for 4 years. There's actually been an independent meta-analysis that we didn't publish that showed that that data is the finest of its type published on the use of stem cells for orthopedic purposes. And that was done by a European group, not by us. And we've treated lots and lots and lots of patients through the years, literally tracking thousands of patients in our registry. So let's end this up over here, and then I'll allow you to go check out the website a little further. We have a network of highly trained providers, so you can be treated in Colorado or at a Regenexx network site. Our network sites have mini labs that can perform the same day procedures and that follow our protocols. And if you need a culture procedure in the Caymans, you can get your pre and post injections done through a Regenexx network site. You can find more outcome information and all sorts of information at the Regenexx blog, which is up towards the top here. So if you want to know what's happening on a day-to-day basis with Regenexx, definitely do that. You can also follow me on Twitter at Centeno MD. So it's at C and then CENTENO MD. So it's at Centeno MD. We also have a Facebook page where you can follow all the same information. Is this procedure magic? No, it's a cutting-edge investigational procedure. It does have a failure rate. Some conditions work better than others, and some patients respond better than others. Who's less likely to respond? Patients with more severe disease, patients with a metabolic syndrome, overweight, high blood pressure, prediabetes, less active, high triglycerides, and patients with other significant health problems. And the top 5 questions to ask of any clinic that you might see for this is: how much experience do you have doing this? Where's your published data? And what specialty? You clearly don't want me injecting the wrinkles in your face, nor do you want a plastic surgeon injecting your knee. What cell source? Bone marrow tends to work better than fat for orthopedic issues, but at least there should be a bone marrow component to the practice if it's orthopedics. is imaging guidance used to take and place cells. You don't want to have cells just go willy-nilly. Our review process, you send films and fill out a history form. You get on the phone with a clinic physician, and we will grade you good, fair, or poor candidacy. All of our reviewers are taught to be pretty tough. We have no problems telling patients that they are poor candidates for a given procedure, and we would much rather do that. And if you still decide to go forward with the procedure, then we can underpromise and overdeliver, hopefully. But recognize that we take candidacy very, very seriously. Well, that's it for today. I think we've covered an awful lot of information, just a 30,000-foot overview of everything we do, and I really appreciate you taking the time to watch.